Hey guys, we are back and we're gonna review our first injury using the EPAT system, and this is plantar fasciitis. Now this is probably the most common injury we treat using the EPAT, and so we're gonna go over it, tell you what to expect and what it's gonna look like. So first off, we have our patient laying on their stomach, and we're gonna start with this guy. Now this is just vibration, it's just prepping the tissue to receive the treatment a little bit better. It sounds a little loud, I'll show you what it sounds like, but don't worry, this feels totally comfortable, no issues at all. All we're gonna do is turn it on, sounds like that, do it in those areas of discomfort, get that tissue ready to go. Once we do that, we might do 2 to 3 rounds of that. We are gonna start in with our actual gun for the EPAT system. And with this, we're gonna be using an ultrasound gel. And basically what we're gonna be doing is the first head is gonna be used on the bottom of that calf, into that foot, into those pain points. And then we're gonna go in with usually a smaller head, something like this guy. A little bit smaller, and it's gonna be more focused on that point of pain. Now, if you're wondering if it's gonna hurt, the goal is no, we wanna go into your pain tolerance levels. We're gonna increase it up to where you feel comfortable, and we can work within that. You are just gonna give us feedback throughout the treatment. And after the treatment, you should feel some relief. Studies show that patients after about 5 or 6 sessions have about 90% relief from their plantar fasciitis pain. After this, the goal is gonna be really focusing on strengthening and making sure that pain doesn't come back. Hey guys, so now we're gonna do some exercises to further help that plantar fasciitis. And the first one is gonna be a stretch for your plantar fascia, right against this wall. So it's called a big toe stretch, which means your big toe is gonna be on the wall, but those other toes should be on the outside of the wall. You're gonna bring your heel nice and close to the wall. And what I want you to think is bringing the pad of that foot down to the ground. You should feel a nice big stretch up your plantar fascia. To increase the stretch a little bit more, what we're gonna do is we're gonna bring our knee into that wall. This should feel pretty intense and should help relieve some of that pain in addition to the EPAT. The second exercise we're gonna go over is gonna be for strengthening of the foot. And you're gonna notice that it looks pretty similar, which means exactly the same as one of the exercises we do for glute strengthening called a fire hydrant. Now, your feet and your glutes are super interconnected. And when you increase the strength of your feet, you usually increase the strength of your glute as well. And a lot of this is tied to balance. So what you wanna do is you're gonna be standing on one foot, knees slightly bent, hips slightly bent. You're gonna be in this athletic stance, and you're gonna think about gripping the floor with that foot. You're gonna lift this leg up, and you're gonna open and close. Open and close, while keeping this leg as stable as possible. You probably noticed my foot shaking a little bit to keep that grip and keep that balance. That's gonna be strengthening those intrinsic foot muscles, which is going to strengthen the foot and help relieve some of that plantar fasciitis pain.